Did you realize that women have a tougher time surviving their first heart attack compared to men? Within 5 years of experiencing one, nearly half of women either pass away, develop heart failure, or have a stroke, compared to just 36% of men. Hey there, welcome back to Purely Cured. When it comes to heart attacks, women are often the silent sufferers. They're more likely to experience atypical symptoms and have unique biological risk factors. Contrary to popular belief, heart attacks don't always hit you like a ton of bricks. In fact, research shows that women may feel symptoms weeks in advance. Sometimes, these signs are so low-key that they fly under the radar, making it possible for a woman at high risk to have had a heart attack without even realizing it. So, it's crucial to recognize these warning signs to get timely help. Stick around, because today's video is going to spill the beans on all these symptoms, from unexpected fatigue and chest discomfort to cold sweats and heart flutters, right down to those hard-to-pin-down feelings of being unwell. Stay tuned to get the full scoop. Why the signs of a heart attack aren't one-size-fits-all for men and women. First off, the way arteries get blocked in men and women isn't the same ballgame. Men usually face blockages in their main arteries, while women often deal with something called coronary microvascular disease, which affects the smaller blood vessels. Secondly, the usual suspects like high cholesterol, elevated blood pressure, and obesity impact both genders. However, women with diabetes are skating on thin ice when it comes to heart disease. The same goes for women who smoke or lead a sedentary lifestyle. Let's not forget, menopause and pregnancy complications can also tip the scales for women in terms of heart disease risk. Alright, now that we've set the stage, let's dive into the signs and symptoms. 1. The beat goes off. Understanding heart palpitations as a warning sign. Heart palpitations can feel like your heart's playing musical chairs, from skipping beats to pounding or throbbing away. A steady heartbeat is your body's metronome, keeping the flow of blood in check. When that rhythm gets disrupted, it could be your heart sending out an SOS for a potential heart attack. Especially for women, heart palpitations linked to a heart attack can create a sense of anxiety or unease. Some folks even say it feels like their heart is pounding in their neck, not just their chest. Don't turn a deaf ear to these rhythm changes. If your heart's beat goes haywire, medical intervention is needed to get it back on track. And here's the kicker. If these palpitations come with other symptoms like dizziness, chest pressure, or even fainting, you might be on the brink of a heart attack. So, take it seriously. 2. When breath becomes a battle. Recognizing a heart attack's silent alarm. Shortness of breath. It's like your heart and lungs are supposed to be waltzing together, but when your heart fumbles, say, during a heart attack, you're left out of breath. Your heart's main gig is to pump blood to every corner of your body and to swing by your lungs for a hit of oxygen. If it can't keep up the pace, you might find yourself panting for air. Consider this. A simple stroll to the mailbox suddenly feels like you've sprinted a 5K, leaving you breathless and bone-tired. This isn't just run-of-the-mill fatigue. It's as if your body's thrown in the towel. And for women, this can be a glaring red flag that a heart attack is lurking in the wings. 3. The sneaky culprit. Unusual fatigue as a heart attack herald. Unusual fatigue, let's face it, life's a juggling act. Between managing a home, clocking in hours at work, and looking after aging parents, feeling tired is pretty much par for the course. It's the norm for many of us. But here's a heads up for the ladies. If you're hit with a wave of fatigue that's new or hits you like a ton of bricks, it's time to sit up and take notice. Keep an eye out for these red flags. Your regular workout suddenly feels like climbing Everest, or you're not even pushing the envelope, but your chest feels like it's got a lead vest on. If everyday tasks like fluffing pillows, strolling to the loo, or doing a grocery run leave you feeling wiped out, it's not something to brush off. And if your slumber is more toss and turn than rest and rejuvenate, that's another piece of the puzzle. So, what's zapping your energy these days? If you're finding that mundane tasks are leaving you more drained than they should, drop us a comment below. 4. Stomach pains, a misleading messenger for heart attacks. Stomach pain. Ever had that gnawing pain in your belly and brushed it off as heartburn, a stomach bug, or a pesky ulcer? Well, sometimes your tummy is trying to tell you something more serious, like a heart attack in disguise. And for women, it can be particularly sneaky. Imagine the sensation of an elephant deciding your stomach is its new favorite chair. that overwhelming abdominal pressure isn't just a sign to lie down. It could very well be a heart attack. If your stomach pain is making you double over, it's time to listen to what your body's really saying. 5. The chilling clue. Cold sweats as a heart warning. Breaking out in a cold sweat. It's a symptom that might not set off alarm bells at first, especially for women who might chalk it up to the usual suspects like menopause. But here's the lowdown. When your arteries are clogged, your heart has to hustle harder to pump blood. This extra effort can turn on your body's cooling system, breaking out in a cold sweat to keep your temperature in check while your heart's putting in the extra work. So, if you find yourself suddenly drenched in a cold sweat, it's not something to just wipe away and forget. It could be your body waving a red flag for heart trouble. And remember, night sweats aren't always just about menopause. They could be hinting at heart issues too. If these symptoms sound familiar, don't put off seeing your doctor. It's better to address it head-on than to wait until it's a race against the clock. 6. Pain's hidden messages. Neck, jaw, and back discomfort as heart trouble signals. Neck, jaw, and back pain. Our bodies are marvels of communication, sending signals from one area to another when there's trouble brewing. When your heart's in distress, it might not just cry out with chest pain. It can send out an SOS through your neck, jaw, or even your back. If you're feeling pain that's hard to pin down, with no obvious culprit like a pulled muscle or a known injury, it could be your heart talking. Especially for women, the pain might not stick to one place. It could travel to either arm, not just the left, as is common with men. You might feel a mysterious ache in your back that starts out in your chest and then decides to take a tour. This kind of pain can be a real sneak. It might hit you out of the blue, without any physical strain, and even keep you awake at night. And if there's a peculiar pain on the left side of your jaw, that's another red flag. When these pains come and go with exercise, fading as soon as you stop moving, it's a hint to pick up the phone and make that doctor's appointment. Don't wait for the pain to become a regular guest. Get it checked out. 7. Stomach troubles. Could it be your heart? Indigestion, nausea, and vomiting. These are the kind of guests that often show up uninvited and can be mistaken for signs of a less serious nature. It's not uncommon for folks to feel a bit of gastrointestinal upset before a heart attack strikes. And since heart attacks tend to visit older individuals who are no strangers to the quirks of digestion, these symptoms might be mislabeled as just another round of heartburn or a disagreement with dinner. But here's the thing, if you're the type who usually boasts a cast iron gut, and suddenly you're grappling with indigestion or heartburn, it might be your body waving a flag that there's a bigger issue at play. Sure, indigestion can be just a passing storm caused by something you ate, and there are definitely some notorious nousas that can stir up stomach trouble. However, if your tummy is throwing a tantrum and it's not your usual fare, it might be time to listen a little closer to what it's trying to tell you. 8. Beyond the drama. Understanding subtle heart attack signs. Pressure and fullness. When you think of a heart attack, the scene often plays out like a dramatic moment from a movie. Someone gasping, clutching their chest, and then collapsing. But real life isn't always so theatrical. During a heart attack, chest pain can be on the playbill, but it's not always the star of the show. Sometimes it doesn't even take the form of pain at all. It might sneak up on you as a feeling of pressure or a tight squeeze in your chest. This discomfort is your heart's way of telling you it's running low on the oxygen-rich blood it needs. It's like your chest is caught in a vice, right in the center, and this sensation can come and go, lingering for a few minutes before taking a break, or it might make an encore. This is your body's signal flare, alerting you that your arteries might be in a pinch. 9. The warning spin. Lightheadedness as a heart attack symptom. Lightheadedness. It's a feeling that can catch you off guard, dizziness, or a lightheaded sensation that can hit during a heart attack, and it's something women often report. It's like the room takes a gentle twirl when you stand up or put a bit of effort into something. If you're feeling so woozy that you think you might faint, it's a sign that's far from normal and definitely not one to brush aside. 10. The unsettling hunch. When feeling off could mean a heart attack. A vague feeling of illness. It's that all-over kind of lousy that's hard to nail down, like you're on the brink of getting sick. This general malaise can be a companion to a heart attack. You might brush it off as just feeling tired or a bit dizzy, maybe even wondering if you're about to faint. For some women, It's like an internal alarm bell that rings in the form of a panic attack or a wave of intense anxiety, often described as a foreboding sense of doom. It's more than just feeling under the weather. It's your body's way of signaling that something might be seriously wrong. If you're worried you might be having a heart attack, it's critical to act fast and seek medical help immediately. And there you have it, folks, a rundown of the less obvious, yet equally critical signs of a heart attack. Remember, your body has its own language of warning signals, and it pays to listen closely. Whether it's an unusual bout of fatigue, a mysterious ache, or just feeling off, these symptoms are your cue to take action. If you're experiencing any of these symptoms, don't wait and hope they'll disappear. Reach out to a healthcare professional pronto. Your health is priceless, and tuning into your body's messages could save your life. We hope this video has shed some light on the important, yet often overlooked signs of a heart attack, especially in women. Knowledge is power, and being informed could make all the difference in a pinch. Before you go, hit that like button if you found this information helpful. Share this video with your friends and family because staying heart healthy is a team effort. And don't forget to subscribe to Purely Cured for more videos that help you stay informed and in charge of your well-being. Stay vigilant, stay healthy, and remember, we're in this together. Until next time, take care.